Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. Thank you for staying afterwards, and we'll just bomb through a bunch of questions.
Awesome.
What are the chances of developing Parkinson's in South Dakota? Some say we're a pocket for this. Also, is there a diet to combat Parkinson's? So are we a pocket?
Are we a pocket? Anywhere in the Midwest, particularly in areas where we do farming and ranching, and seems to be a problem. Yes, it is definitely higher.
Yep. Mm-hmm. And is there a diet that works for it?
Is there a diet that works? Again, getting back to healthy food.
To anti-inflammatory. It might be an inflammatory disease. We don't know.
We don't know. I would say the most important thing is an exercise program. I had one jogger who jogged through it until 10, 15 years into it, and he was a physician. Yeah. Coleman. 2008, peripheral neuropathy extends to the ankles, burns, cold sheets make it intense. Anything besides pain meds that I can do? Peripheral neuropathy.
Peripheral
Lori.
neuropathy. Is anything that's medications probably. It depends on the cause of peripheral neuropathy. The most common cause is diabetes in this country. There's a whole laundry list of other ones. Alcohol, yeah. Alcohol.
Smoking.
Well, smoking can exacerbate it. It's not particularly the cause. You can have peripheral vascular disease that affects the nerves. That causes neuropathy as well.
We want to make sure everybody checks their B12 and thyroid.
I know, we do.
Yep,
Absolutely.
B12, yep. Mm-hmm.
Is it possible to completely recover from a bipolar disease? Kevin?
I don't think so. I just don't think so.
You don't recover. You
always have it, but it is controlled, absolutely.
Remission.
It goes in remission, but you don't recover. It can always show up.
So don't drop your medicine and say I'm cured.
Don't drop your medicine and say you're cured, absolutely.
Specific for Dr. Wise&C. Rapid City vet wants to know why emergency and long-term care is provided, but it is so hard to get dental care.
I agree. I think they should get dental care. I think the veterans should have dental care as well.
And we don't seem to get
We
it.
don't. You have to be, I believe, 100% service connected to get dental care in the VA. Your teeth are part of your body, and if your teeth are in
bad.
whatever. They're bad. They're part of your body. I believe that it should be.
And a nitis for inflammation again.
Of
I mean,
course.
it's a nidus for inflammation. The C-reactor protein, which is an inflammatory protein, goes up with poor dentation.
Pneumonias. Sky high with bad teeth.
Bacterial endocarditis of the heart.
Bacterial
Infection of the
endocarditis,
heart. And, it should be part of all healthcare plans.
From Facebook, it's not the quantity we eat, it's the quality that is lacking. Comments?
I mostly agree with that.
Quality and quantity.
I believe it's quality. I do think we got to reduce the quantity.
Both.
But you get a nutrient. What he's saying is you got to eat a nutrient-dense, low-calorie food. Nutrient-dense is the quality, and make it low-calorie, and you're going to get enough quantity.
Right, and so the best nutrient-dense things are like sweet potatoes,
whole
broccoli,
fruits and vegetables,
fruits,
and healthy meats and fat, and healthy fats are, fat gives you satiety. You feel full on fat, so you don't have to eat a lot if you eat some fats.
Read my book. Oh, honey.
But at any rate, it's a balancing act.
It's a balance.
Yes.
It's a balance. So I think quantity is a huge part of it, and quality, and I agree. It's nice that we had a chance to say both.
Both, right.
Caller had a routine physical and was told that he had a UTI, the cultures grew staph. How could this happen when he had no symptoms? 77-year-old man.
You have to look at the urinalysis. You have to see,
Would you treat a guy who's
I don't think I
asymptomatic?
would. Yeah, no, I would not. I think you're going to the risk far outweighs any benefit.
The risk of an antibiotic is significant.
Absolutely,
It is.
absolutely.
77-year-old from Sioux Falls got a shingle shot with neomycin, with a neomycin allergy. Caller, has a neomycin allergy? Can he get a shingle shot?
Yes, it's a live virus, but yes.
Yeah,
no problem.
It is it's a beat up
live virus.
It's kind of going.
Yeah, it's frozen.
And it's had a hard life, and it's not very strong, but it's enough.
Semi-attenuated, I think is what they call it.
Attenuated.
Yeah.
Did you begin as a 911 dispatcher?
I did.
What? This is.
I love it.
So what's the story?
I started out in Sioux Falls. I was a 911 dispatcher. That's correct.
Wow, neat.
Yep.
Someone went, I bet she was
I
that lady.
recognized her.
I know that lady.
By the way, we shared a call together. We didn't even know each other.
Yeah.
I'm a little younger than her, but she was a 911 dispatcher. and the scene is very unusual. But she dispatched people to our scene. We talked about this years down the road.
Wow, and you didn't know it.
And we didn't know it. We didn't know each other.
Until after here was this case.
Oh, it's a huge case.
dispatch.
I'm going to write a book about it.
Next book.
Can you say anything more about it?
I cannot, but it does involve Attorney General.
Oh. All right, Belfouche, South Dakota. So it was a while ago. That's what it is. I know that. 24-year-old son had first grand mal seizure, had a CAT scan. Should they have done further testing? Grand mal seizure is a CAT scan enough?
Yeah, I don't believe so.
What would you? An MRI.
Yeah, an MRI, and there's a protocol for seizures and in
Lumbar puncture?
No, if he's not sick, he wouldn't need a lumbar puncture. You look for signs of illness and so on. But yeah, MRI, EEG.
And I would add, as a general internist, sleep study, panel C, CBC.
Sleep study in a 24-year-old, unless he's obese, probably isn't the first thing. And you get a lot of information about a sleep-deprived EEG about their sleep. So,
yeah?
Oh yeah.
Okay. I think that we under-sleep study people. There's so much sleep.
Well, there's a lot of pathology, but hopefully by 24 you don't have that problem, but you may.
There was a study in Australia, 13 years, from 30 to 65 years of age, the people who had sleep apnea. Without sleep apnea had a 6% death rate, kind of what you would expect in that group for 13 years, right? 30 to 65.
Wow.
And those who had moderate to severe sleep apnea had a 33% death rate.
Wow.
5 times higher risk of death who had sleep apnea. Caller has shingles twice after getting a shingles shot, now has post-herpetic neuralgia and eye damage. She's on medication but still having pain suggestions. I would make one comment. I really looked at this literature just lately. The shingles shot doesn't eliminate it, but it reduces, and it by 50% the incidence and by 50% the severity.
Right.
Do you agree with that?
Yeah, absolutely. Yeah.
The post-herpetic neuralgia is far worse.
If you haven't had the shingles shot.
Well, no, I mean, yeah, exactly, and far better if you, or not as bad. The severity of it is not as bad if you got the shot.
And some of the medicines we talked about earlier too that work for neuropathic pains, like gabapentin, pregabalin is FDA approved for that,
Lyrica.
or Lyrica, yeah, and all those other atypical antidepressants, seizure medications, those kind of things. There's topicals, there's lidocaine, capsaicin. You, of course, don't put that in your eye, but those are options as well.
It's interesting. The experts are saying not narcotics, though. Not narcotics for post-herpetic neuralgia.
No,
and it
doesn't work.
This is a very high potential for addiction.
Absolutely.
What do you recommend for migraine headaches that occur somewhat frequently, like 2 to 3 times a month, but are controllable, but infrequently so severe that they are debilitating to the point where I must go to the emergency room?
Well, the triptans, for 2 to 3 times a month, the triptans would be a nice drug if you're sensitive to, and they work.
Like?
Sumatriptan, Imitrex, Maxalt, those kind of drugs, Zomig. That would be the thing, because you can take that and go on with your day. Shots of Demerol and those things that just put you out. No,
but
if you can
prevent it. Now, I mean, beta blockers.
No, 2 to 3 times a month. That's questionable whether a person will. Yes, there's been a recent study that looked at drugs that are most effective in that top tier. Topiramate or Topramax is an effective drug.
Weight loss too.
Divalproic acid, but that's Depakote. It has a fair amount of side effects, and it requires blood monitoring. And curious enough, there was one in that top tier is Butterbur. It's an herb, and I've been Butterbur, 75 milligrams twice a day, and it was just as effective. Butterbur, and I've had the opportunity to, and it's relatively cheap depending on where you get it. And of course, you want high quality with your vendor and so on. But I've had patients that have had dramatic results with it. And then there's all the other medications, the propranolol, the calcium channel blockers, etc.
Amitriptyline and calcium channel.
Yes, and then the chronic migraines, even Botox is a nice treatment.
What causes tingling in the fingers?
Hyperventilation, anxiety.
That's the most common, really.
Common,
and they have numbness around their mouth and they have it on their hands. And what I tell them to is, I don't have them breathe in a bag. I have them go for a walk.
Yeah.
Because you need to breathe faster when you're exercising.
Yeah.
And that's tingling perhaps in all fingers, but there's, of course, carpal tunnel syndrome. That'd be the first 3 fingers, and you could have a cervical radiculopathy that could contribute to that as well.
He and I went to the anxiety. You went right to the neuropathic. per million. Caller has numbness in both feet for the last 6 months. Causes numbness in pads and tingling through the toes. Uncomfortable to walk. What could be the cause? Well, is that the Morton's neuroma, you think?
Well, it could be peripheral neuropathy, and they didn't give an age.
So you want to make sure the thyroid and the B12 are tested.
All those things that are checked into.
Heavy
When
metals.
you're talking about lymphomas and so on, like serum electrophoresis, you can look for if they have an abnormal protein. Sometimes that's an early sign. Make sure hemoglobin A1C is checking for blood sugars and then there's such a thing as called tarsal tunnel syndrome as well. Tarsal, but it's like carpal tunnel, but it affects the feet. So that's another thing. Yeah. So there's a variety of things that can cause it.
I like to say that when you have complex things like this, it's really good to get a general internist.
Honey, honey, what do I do?
So you get a general internist to do a nice, careful history
Workup,
and physical
absolutely.
Yeah,
exam.
it's true, very true. But then when you get all done, then you call your
wife.
neurologist.
Yeah, there you
In
go.
my case, it's a cheap consult.
Krill oil for cholesterol and astaxanthin for arthritis. Do guests agree with those meds for these disorders?
If your arthritis gets better, great, I agree. Krill oil is probably very safe.
It's an anti-inflammatory, so
and it works.
It's
I've had
expensive though.
Yeah, but if it works,
fish oil in general, but fish oil. I've had patients tell me they got off their pain meds or their creatinine started rising and they were on NSAIDs or whatever, and they tried these krill oil or fish oil or what, and it seems to help. It's anti-inflammatory.
This whole inflammatory cascade, the anti-inflammatory is the omega-3s, is the fish oil. So this whole inflammatory cascade can be circumvented by taking fish oil.
But there's some good data to say that people do better on fish than they do on capsules of fish oil. I mean, it's the same as with beta carotene and carrots, or it's. I like ground flaxseed.
Exactly. You turned me on that. I bought that in my book.
Did you?
Yeah. Didn't give you credit
you
for
give
it.
me?
No.
No. Well,
I wanted the credit. I gave Mahatma Gandhi credit though. I quoted him.
Well, there you go.
You're right up there with him.
Oh yeah. Well, that's okay. Thoughts about medical marijuana for pain control, seizures, and Parkinson's? Medical marijuana. Any comments?
I've researched this and they wanted me to talk about it, and there is medical benefit, absolutely medical benefit, and if you're desperate, move to Colorado. It's legal.
I do know that there's some arthritis that is really benefited, and I do know that there are people who have, nausea and or lack of appetite things that they, but that's a select few.
Select few.
I don't want to be the one
to prescribe it.
They have to prescribe it. I would like to.
It's tough. You know what? Just make it legal.
And there's literature about seizures as well, so that we have cannabinoid receptors in our brain, and then there's. I guess I think it's the question still out there about Parkinson's disease, but I've heard numerous testimonials, of course, over the years of it helped me.
And there's also a gene that gets turned on in certain people to cause a schizoaffective disorder when they smoke it.
So they get schizophrenic.
Exactly. Yep.
Sure.
So
I think it has to be,
gotta be
certainly
careful.
some regulation, and but I'm not going to close my mind to anything as a physician.
No, we want to help people.
There you go. Caller has autonomic neuropathy. Autonomic neuropathy, that's another thing, particularly with Parkinson's, they get autonomic.
Is that
Scheidreger's,
right? Gosh, I interturns.
You were so smart. Who could say Scheidreger's fast enough?
Faster than me.
What drugs can be used to help her condition? She has low blood pressure, of course. That's it.
We treat that. You treat that.
Yeah.
Drugs
probably
like
is a better
glucocorticoids, of course, and you have to make sure that person doesn't have issues with congestive heart failure. You need to, or at least monitor for those things. Glucocorticoids, proamantine. There are drugs that have vasoconstrictive properties that can help with that, and there's
But they're expensive.
Oh yeah, they're very expensive, and. Using compression stockings, those good old things. Drink
Great answer.
Gatorade,
Broth.
There you go, broth.
broth,
Enough
Gatorade.
salt.
Yep.
Yes.
And support.
Yes.
But I like the idea of support hose. That's really underdone.
It's underdone.
Important, huge.
They hate me for it, but
They never like it.
Nobody likes it.
Although I had one lady, I begged her to do it. No. Finally, she got into trouble. I got her wearing hose, and she came back and she was mad at me. Why didn't you force me to do those? I had that chance of getting that help all that long time, and you didn't help me. You can't win.
No, you can't.
Can't win.
Has shoulder, upper back pain whenever clothes touches the area. Doctor doesn't know what's wrong. Any ideas what the problem be? So this is a shoulder neuropathy. I've got a guy who's got brachial plexus disease.
I mean,
Can even shingles? Post-herpetic?
Yeah,
There it is.
Post-herpetic, or you hadn't noticed it. Of course, yeah, because you don't always see that area. I mean, so that is something to think about. And sometimes, even before you actually have blisters, months, and it's been even reported years before, there's pain in the dermatomal areas where that virus is trying to come out and do it. So that's a possibility. You can get entrapment of nerves coming off the scapula. I mean, there's a variety of things that can happen. Chronic neck muscle spasms from poor posture back here. There's a thing called notalgia paresthetica, and that actually more typically causes numbness in the back here, but sometimes you get hyperirritability as those nerves pierce the trapezius muscle and they get pinched.
So I would say, for one thing, have your doctor prescribe a prescription for the treatment for shingles and just see if it helps. This zoster sine herpeticum, this herpes zoster without the rash can occur.
Right.
And I think it'd be worth a trial.
Might be worth a try.
of,
And even you doing
pretty
Neurontin
benign.
or gabapentin
or try some
amitriptyline?
gabapentin. Yeah.
Yeah.
Caller has had a low white cell count for 15 to 20 years, 2.7 to 3.3. Should she be worried about cancer?
I just monitor it and just keep monitoring and keep monitoring it. And,
Yeah. 15 to 20 years,
Not likely an
Keep
issue.
monitoring
And medications are often
the cause.
the cause, and you might want to look through that list, but that doesn't mean you have to go off them if it's that.
Right.
That's okay.
And there's probably, I bet she has an inherited, one of those inherited things.
And just get an infection, she'll get that up.
Yeah, it'll go up if she gets
Or
it.
take a course of steroids.
Yeah,
Right.
one or the other. Don't worry about it.
Don't worry.
Yeah, I think
But
it's okay.
you get a sign of infection, get to the doctor. Ipswich, hip surgery, new kind, cutting from the front or cutting from the side. What are the benefits from cutting from the front?
Wow, I have some pretty good success stories
With the new
with the
hip surgery?
Yeah,
Yeah.
and so the patients are seeking out those surgeons that
Yeah.
are doing that,
Yeah.
and
Hearing good things.
yeah, I mean their downtime is a lot less.
Yeah.
It's incredible. I love technology.
It is.
Advances in medicine. Let's keep going.
But not for everybody. There's
Not
some
for everybody.
people.
Yeah, not everybody qualifies for it. Yep.
And the last question.
Okay.
I'm a 79-year-old plus female with pulmonary hypertension. I have severe time breathing, even if walking a few steps. Do you have suggestions on help? It's gotten much worse the last 6 months. Finally went to a lung doctor at Avera. He's doing tests, and I'm very low on oxygen by the tests. I'm to sleep over on October 30th next week. I'd appreciate any help. So, pulmonary hypertension.
Needs
Ken.
oxygen, it sounds like. I mean, it's the lung pressures are high. Weight loss would help, obviously. And she needs, obviously, the lung doctor's aware of that, but they're doing a sleep study, I'm sure. And you worry about blood clots, recurring blood clots.
That's right. And
Yeah.
so, I mean, I think the idea of, but if you've got primary pulmonary hypertension, which is no cause, have no,
Idiopathic, right.
then they treat it with sildenafil.
Viagra.
Generic, 20 milligram
right,
Viagra. It's cheap.
And the drug of choice for high altitude climbing.
Really?
Yeah.
Altitude
Yeah.
sickness.
Okay.
So if you do the 14Ks in Colorado, trying to treat your Parkinson's,
Take your Viagra.
take your
first.
Viagra.
Take your Viagra, and you have, I won't go there. So, thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next Thursday at 7 p.m. Central Time on South Dakota Public Broadcasting. Call in or email your questions. Watch Prairie Doc Perspective column on your local newspaper. Listen to our Prairie Doc Conversations radio show on a station near you, and follow us on Facebook, Twitter, Pinterest, and don't miss next week's show on Frankenstein. And so until next time, get a flu shot and stay healthy out there, people.
Very good.
Thanks.